Hello, dear colleagues. And today I'm very happy that I'm allowed to make a review about a very special course, very dear course to my heart, because this is 4 lectures, 4 lessons from my teacher, the person that I'm proudly can call my mentor, Dr. Mauro Fradeani. And I'm sure that you heard the name Mauro Fradeani because he's one of the most famous, well-known, esteemed and honorable doctors, prosthodontists in the world. And maybe you've seen his book. Actually, there are 2 volumes of his book. Maybe you have seen his articles. Maybe you have seen his name in the list of speakers on different international congresses and symposiums all around the world. Or maybe you were lucky enough to hear one of his presentations, one of his lectures somewhere in the world. And right now, Dr. Mauro Fradeani has thousands of students, thousands of dentists who were trained and taught by him, and also he has a lot of collaborators, very young and very talented doctors that decided to be a Fradeani Education team. So what is these 4 lectures about? First of all, these 4 lectures dedicated to the treatment of complex cases and what is required in order to perform the comprehensive treatment of complex cases to achieve aesthetic result, to achieve functional result, and most important, to achieve very nice biologic integration of the restorations we are fixing in the mouth. And what is needed for that? First of all, of course, it starts from diagnostic, from the data collection and processing of this information. And Dr. Mauro Fradeani will share with you his approach to the facial analysis, to the dental facial analysis, to the smile analysis, also teeth analysis, how to analyze the teeth exposure at rest, how to analyze the size of the teeth and the form of the teeth, how to perform phonetic analysis in order to understand what is the best possible position of the teeth, because the starting point of every treatment planning is the position of the incisal edge of upper anterior teeth. Only then you can decide what else you have to do in order to achieve beautiful smile and very good result. And he will show you step-by-step process of analyzing this information, what does it mean and what kind of clinical steps we should undertake according to the information that we received, that we analyzed. And for the doctor that is very famous for his aesthetic results, during these 4 lectures, Dr. Mauro Fradeani dedicates a lot of time to the function. He starts from the question about how to put on the face bow, how to make the face bow registration in order not to have any mistake in the transferring of the occlusal plane inclination to the dental technician on the models, whether it would be analog models or it will be digital models, what means we can use like digital tools, or how you can rely on horizontal plane and not to be mistaken by, for example, the canted interpapillary line or canted intercommissural line. So these kind of functional questions that are very important, not from the point of view of aesthetic per se, but also from the point of view of the function, the static and dynamic occlusion. Then how to understand what is the meaning of phonetic analysis from the point of view, for example, of the buccal-lingual position of the upper teeth. Also, how to correlate the buccal surface of anterior upper teeth with a reference plane like camber plane that will help you to combine the aesthetic and functional result at the same time. And also the question about what would be the starting point of our comprehensive treatment. Would we use MIP, maximum intercuspidation position, or like Mauro Fradeani does in all his comprehensive cases, we will rely on central relation. And what is this central relation? Because we know that this term, this definition is still very contradictory topic in the prosthodontic dentistry. So from the point of view of Mauro Fradeani, this is a position of the lower jaw that will be reproducible, that will be stable, that will not create muscle tension, and it will be muscularly stable position of the joint. So muscle skeletal stability, and how to register this centric relation and how to register this kind of centric relation when we have some kind of anatomical, morphological problems with TNJ, and when we are not registering the centric relation in a classic way, but we are registering something like adaptive centric posture. What means Dr. Mauro Fradeani uses, what kind of maneuvers and what kind of materials he utilizes for that very important step in the practice. And so here Dr. Mauro Fradeani will present to you his new concept that he started to use several years ago, and I think it revolutionized dentistry in a way, because it's MIPP concept, minimally invasive prosthetic procedures. So this concept is dedicated to the idea of being minimally invasive, so in order to preserve the tooth enamel. Dr. Mauro Fradeani will give you the hints, the tips and tricks how to do that, and what is the difference in MIPP 0, MIPP 1, MIPP 2 or MIPP 3. And in that case, you'll have a certain guidelines how to be less invasive in your treatment. And it's not just the idea of one doctor, because right now it's evidence-based treatment strategy, and it is proved in the scientific literature, and some articles were written by Dr. Mauro Fradeani and his team based on the huge amount of patients they treated together. So you can be sure that whatever you follow this protocol, it is scientifically proven, and you will see what is the difference between the conventional teeth preparation that we used for many years, what is the modern way of preparing of the teeth, how to preserve a teeth enamel. And right now Dr. Mauro Fradeani doesn't do anesthesia to his patients because they don't need it, they don't feel anything during the teeth preparation. What about the ceramic? What about new ceramic materials, new restoration materials? What about the etchable ceramics like lithium disilicate, emax? What about which way we would use it? Maybe it will be monolithic restorations, will be layered in restorations. What is the thickness of these restorations? And what is the difference from the classic guidelines presented by the manufacturers many years ago? Because these guidelines are not used anymore. There are certain differences. When you bond to enamel or when you bond to the dentin, you are allowed to make different thicknesses of the restoration, because the substrate itself would be additional means of having more stiffness, more reliability of these restorations on the teeth. What about veneers? What about crowns? And what about the type of restoration Dr. Mauro Fradeani calls full veneer, when it's the shape of the crown but the thickness of the ceramic is so thin that you are not allowed, as he says, to call it crown. It's full veneer that is covering the complete surface of the anterior teeth. What about the zirconia? Is there still place for the zirconia, and in which way, in the monolithic or layered? What about the complex cases when you need to combine a treatment for orthodontic treatment with periodontal treatment with implant treatment, when you have to do prosthetics on implants, also prosthetics supported by teeth? So different cases, a lot of clinical examples of his work with superb, really great aesthetic results, but beside that, long-term results, because he will show you cases dated from 1995, 1996, almost 30 years of long-term results, and he will show you cases that were treated in his new MIPP concept and how reliable it is to achieve very nice aesthetic result, to be minimal invasive, and at the same time to provide very nice function, occlusion and durability of the restorations. And this course, as I think, would be very nice preparation if you want to follow this concept, if you want to use this concept in the practice. You can just decide for yourself whether you need to have more knowledge in this concept, and if you really need to know more, to practice more, there is possibility to visit Dr. Mauro Fradeani's OHI-S Institute in Pesaro, Italy, where he provides his educational courses. Right now there are 3 modules. Each module consists of 4 days of lectures, of hands-on courses, of live demonstration, where you can get much more deeper information about his concept of treatment, about clinical steps of the realization of this treatment, and achieving very nice and predictable result. You will be able to provide good aesthetic result, and it will be also predictable aesthetic result. It would not be a surprise for you or for the patient in the end of the treatment, because as I've mentioned before, Dr. Mauro Fradeani shows you how to do cross mounting and how to repeat the restorations from provisional stage that were appreciated by the patient to the final result when you just change the material. So how to provide very nice functional result, once again using this information of the function, of the mastication, of the register of central relation, of the work with face bow and other functional means, and how to get the long-term stable, durable result. So I'm sure that these 4 lectures, at least these 4 lectures from Mauro Fradeani, will help you to achieve great result and will help you to get grateful patients. So thank you very much and enjoy the course by Mauro Fradeani.